Welcome back, student, to the another video tutorial of rheumatoid factors. So, rheumatoid factors is a chronic inflammatory disease in which our immune system that do not recognize the self-produced antibody. So, what happened in rheumatoid factor is that this is the normal IgG antibody that is produced by this our immune systems in order to fight germs. Then against this against this normal IgG, you can say against this the Fc portion of IgG, our immune system that produce IgM antibody or IgG antibody, okay, against this Fc portion of IgG antibody. This is a normal antibody and this is the auto antibody. And this auto antibody, that is IgG or IgM antibody against this Fc portion, is called as a rheumatoid factors. Once this auto antibody is produced and that Fc portion of this normal IgG that attach with this Fab portion of this auto antibody, that leads to activation of complement system. Okay, and once this complement system is activated, that get attached with this Fc portion of this normal IgG, and that leads to hypocomplementemia. Once after the activation of complement, this complement that activate inflammatory cytokines, and these inflammatory cytokines that can damage this different organ, but most common organ is pericardium, lungs, and joints. So there is a test, that is RA test, that can be done in laboratory to detect this RA factors in the patient serum. So this RA test can be done by the two method, screening method and qualitative method. So RA factor test, what is the principle of this RA factor test? There is the RA reagent that consisting of latex particles coated with this IgG antibody. Okay, IgG antibody. If this patient serum is consisting of rheumatic factors, if this patient serum consisting of rheumatic factors and mixed with these latex particles, then this RA factor that attach with this latex particle coated with antibody that leads to agglutination reactions. So this slide, so what are the things that required to perform this RA test? Okay, number one is specimen that required fasting serum, and RA kit that consisting of polystyrene latex particle that coated with human gamma globin and normal saline. So first we'll talk about procedure of screening test, RA test, screening RA test. Okay, to perform this screening RA test, we need to dilute this patient serum into 1:5 dilution. So how this 1:5 dilution is prepared? First, 0.1 ml of patient serum is mixed with 0.4 ml of normal salines. And this dilution is one drop of dilution that placed on a 1 joule of RA card test. Then after putting of one drop of this patient diluted patient serum, put one drop of positive control or no negative control on this next 2 joule of this RA test kit. Then add one drop of reagent, RA reagent on each of this zone. Okay, then mix well and check agglutination after this 2 minutes. Then this slide shows procedure of qualitative RA test, and for this qualitative RA test, we need to prepare various dilution of patient serum. First dilution is 1:10, 1:20, 1:30, and 1:50. And each of this dilution that indicates 40 ml IU per ml RA factors, 80 IU per ml RA factors, 120 IU per ml RA factors, and 280 IU ml per RA factors in the patient serum respectively. If the if titer of this test is more than 180, that indicates positive result. This RA factor test can give false positive in all this following condition: SLE, that is systemic lupus erythematosus, scleroderma, connective tissue disease, syphilis, leprosy, tuberculosis, subacute bacterial encephalitis, infective in hepatitis, and malaria. And there is so many conditions in which this RA factor test can give false positive result. There is another test that can detect, that can differentiate this rheumatoid factors to the other arthritis, from the other arthritis too, and that test is called as NTCCP test, cyclic citrulline peptides. Actually, this is an autoantibody that produce against cyclic citrulline peptides, that cyclic citrulline peptide, actually it is circular peptides that consisting of citrulline amino acid. So thank you very much to watching this video. I hope all of you understood about this video.